but we will officially get started. So if we can accept that little prompt. I want to begin by saying welcome. My name is Jeanette Davis. I get to be here and they have given me this title, Community Health Specialist for Recovery Supports for Logan Mason ROSC. But as you all know, I'm here, hot mess on my best day, and I'm here to share that with you guys as we work together to make a difference in where we live and where we serve. So thank you for deciding to be here. You could have chosen to be anywhere, and you made the decision to be here. So thank you for that. Grace is going to help me because I still struggle with chewing gum and walking at the same time. So you got to know that working a PowerPoint and a Zoom all at one time can get a little overwhelming for me. So thank you for the support, Grace. Again, this is the Logan Mason County ROSC meeting. ROSC meaning Recovery Oriented Systems of Care. We meet the third Thursday of every month. And currently it is via Zoom following the link you follow today. So thank you. We'll peek at what we're going to do today. We're going to go over what actually is a ROSC and what our mission is ourselves as far as Logan Mason County ROSC. We'll do introductions, just looking for name, your agency or affiliation. We'll go through some event updates, some resources, and then the meat of our time together, we're going to do some recovery talk. And part of that recovery talk is with the topic of harm reduction. So we'll dive more into that. We'll get into some upcoming events. We want to hear from you too, and what you have going on. And of course, our thank yous and our next time we'll meet again. So a little rundown of what we're doing. What is a ROSC? What is a ROSC? This is the definition, right, that is given to us. And that's a lot of words, and you feel free to read those words. It's important that you know them. But for this occasion, I will just say that we are just definitely a network of folks trying to work together to create a comprehensive recovery community. That's really our goal. We cannot do it without you. And so that brings us to our individual or independent mission statement as our Logan Mason County ROSC. And after taking our community surveys and coming up with our strategic plans, this is our goal, is to improve access to health, wellness, and holistic recovery options for people who are at risk of or suffering from substance use disorder, while educating and connecting Logan and Mason counties to reduce stigma and improve recovery outcomes. A lot and all necessary and important. And this is what we hope, that everything that we put our hand to, that we can look back at this and see that we're in alignment with what our mission is. So, that's what we're a part of here when you come and learn about the ROSC. So I've shared a little bit of who I am, but I definitely want to know who's in the house. So if we can do names and agencies, and I think maybe it is a little easier if I call on someone. So that's my strategy for today. And so if I can call on you and you can share that with us. And I'm going to go ahead and start with Grace.
Hi, I'm Grace Irvin. I am a prevention coordinator at Chestnut Health Systems, overseeing the substance use prevention grant and also the ROSC grant. Serving Logan and Mason. I don't know if I said that.
Thank you. Bryson.
Hey guys, I'm Bryson McFadden. I'm the new outreach worker for Oxford House of Sangamon County, Logan, and Macon County.
Awesome. Glad you're here. Hey, Rob.
All right, Rob Harmon. I'm representing the First Presbyterian Church. We're always interested in outreach kind of things, and mental health was one of the things we've identified as a need in our community. So just looking for opportunities.
Glad to have you here, Rob. Molly.
Hi, my name is Molly. I'm the community health coordinator here at Lincoln Memorial Hospital.
Awesome. Miss Sandra.
Hi, I'm Sandra England. I am the case manager for the Taylorville SIU Family Medicine Medication Assisted Recovery Program.
Glad to have you, Sandra. Riley.
My name is Riley Teberg. I'm from Sojourn Shelter and Services. I am the prevention and outreach specialist. And Beth Nessler just asked if I wanted to join in on here today. So yeah,
So
I'm excited
glad
to
to-
be here and learn.
Glad to have you here. Silas.
Hi, I'm Silas Taki. I'm the CSBG grant coordinator at Community Action, and we serve Logan, Mason, Menard, Piatt, DeWitt, and Fulton counties.
Awesome. Caitlin.
Hi, I'm a case manager for Fulton Mason Crisis Service and also the Fulton County Children's Advocacy Center.
Thank you for being here.
Yeah, absolutely.
Kara.
I am Kara Davis. I am the Director of Nursing at the Logan County Department of Public Health in Lincoln.
Awesome. Love you're here. Tyler.
Hi, everyone. I'm Tyler Winger, Prevention Specialist at Chestnut Health Systems, and I service Logan and Mason counties.
Awesome. Trenda.
Hi, everyone. Trenda Hedges. I am CEO of a brand new peer-run organization called Peer Power. We've been operating statewide in Illinois and also in other states. And so we envision lives, communities, and whole entire systems positively impacted because of lived experience through peer support. Good to be here with you all.
Love it. Brooke.
Hi, I'm Brooke Allen. I'm the program coordinator of Community Health and Recovery Services at SIU Family Medicine. I don't know if some of you probably remember William Gabe Hovendon. He's no longer with SIU, so I'm just stepping in his place for a bit. So
Awesome. Thank you for jumping in that spot, Brooke.
absolutely.
You didn't skip a beat. Thanks. Nadia.
Hi, everyone, or good afternoon. My name is Nadia Kleekamp. I work at Chestnut Health Systems and help support everything in Central Illinois and statewide through prevention and recovery and all the things in between.
All the things. Thanks for being here. Jeff.
Hi, my name's Jeff McFadden. I'm the System of Care Coordinator for Bridgeway's West Central Illinois ROSC. So I'm basically like Jeanette up here in Galesburg. So good to see everyone. Glad to be here.
Cammie.
Hi, everyone. I'm Cammie Garrison. I'm the Region 3 Technical Assistant through Chestnut Health, and I'm here to just help Jeanette out in any way that I can.
Thanks, Cammie. Tristan.
Hi, guys. Tristan McGrew. I'm serving with Recovery Corps, alongside with Jeanette with the Logan Mason County ROSC through Chestnut, and a person with lived experience. Thanks for having me.
Awesome. Naomi.
Hello, I'm Naomi Willis, Business Development Coordinator with Gateway Foundation. If anyone was just on the West Central ROSC, I forgot my territory. So I can tell you right now, if you go up in Illinois, you go from Rock Island, take it all the way down to the bottom of Logan County. And as far as you can make it into Iowa before I retire, that's my service area. So I'm glad to help anyone and everyone who comes through that area because to be quite honest, if it's someone who is from anywhere, it doesn't matter if they're in that area or not. You can have them call me if they need help when it comes to accessing services at Gateway Foundation. And we do substance use, and we're now branching into the mental health side of things. So if anybody would like to connect and speak more, please feel free to message me, private message me, and I'll also put my information in the chat. So please feel free. I hope to serve as a resource for as many of you as I can.
Thank you so much. Joanna. You know I'm excited when I start singing names and stuff. Like, forgive me. This is my excitement.
Hello, everyone. Good afternoon. Joanna Gonzalez, IDHS Super ROSC Coordinator, also just kind of statewide.
Yes. Thank
Thanks
you for
having
joining us. No, I'm glad you're here. Frankie.
Hi, everyone. I'm Frankie Ward. I'm the recovery specialist with Ford County ROSC, and I'm also a person in long-term recovery.
Awesome. Dominic.
Hey guys, Dominic, community health specialist through Chestnut. I'm also with Tyler, serving the Logan and Mason County subs.
Absolutely. Thanks for being here. Miss Kim.
Kim Turner, Logan County Probation, and Hope on Fifth.
Glad you're here, Kim. And Beth. Oh. Well, maybe she's having some technical difficulty. I know that was Beth Neffler, and she is with Solgen, that does amazing, incredible things. I'm sure if she doesn't pop back on, we'll have Riley say a few words on our behalf. But that she also does some amazing work with Solgen. So, oh, and we have Samantha Martini. You just jumped in time for introduction. Just your name and what brings you here?
I am Samantha. I'm a person with lived experience, and I'm here because we need help in the community.
Awesome. Yes. And not only is she a person and a champion in our community, she also works at Chestnut Health Systems in the residential department. It's amazing when we can serve where we once were clients. We don't want to forget mentioning that. Thank you for being here. All right, folks, we have a full house. And again, that is exciting, exciting, exciting. Those of you who have joined in the past, you know, kind of my theme is to have us ponder on something, a quote of some kind. And this is truly one of my quotes of my life that I picked up along my journey that I hold close to me. And it's the one quote that I seem to be able to recite and recall in moments of the work that we do, remembering I'm only one, but still I am one. And I cannot do everything, but still I can do something. And because I cannot do everything, I will not refuse to do the something that I can do. I just feel that this may be a season for us to hear that, and just hopefully to stay encouraged that, you know, we all have something to give. So just leaving that with you as we move forward. So we want to do just some updates real quick here. Last Saturday, we were able to have the presentation of Generation Found here in Lincoln, Illinois at the cinemas. And we had some folks show up. You know me, I'm always, well, I guess I have to remind myself, I've learned the rule of meeting. Whoever is supposed to be there is exactly, whoever's there at the moment is exactly who's supposed to be there. And although I would love to say we flooded it in and there was no seats available, we still, I think it was a weekend where it was St. Patrick's weekend too, right? Where people were out and about. But we did have a community showing. We had great conversation, some incredible dialogue, and we had a group of people that when they left there were charged to learn more about what this documentary speaks on in recovery high schools and different options for our young people in recovery and how those in recovery can help further those efforts. So thank you to all that join us. And don't worry, if you missed last Saturday, I have news for you. We are repeating the event again in Mason City this Saturday at actually, is that 2 p.m.? It's 2 p.m. For some reason, that feels like it was supposed to be 1 p.m.
It's 1 p.m., but the flyer is in a different slide.
Oh yeah, my bad. That's upcoming. Okay. I get excited. Okay. So we'll talk about that later. How about I stop there? I did want to give just a second, and Molly, I'm going to pick on you real quick just because Molly is the one that's leading the Logan County Health Community Health Needs Assessment, and we kind of brought that up last meeting. And I thought just if you can give a real quick update of just kind of where that is so that folks don't think that we've asked them to participate in something and kind of leave folks hanging. So if you can give a quick update.
Yeah, I'll try to be brief. There's a lot going on, so I could get very long-winded, but I'll keep this short. Thank you to those that took the survey. I had 428 people take it. And the survey results ended with youth mental health and substance use being the top two, which is pretty common compared to what we've had in the past. Teen substance use is number one, so I feel like ROSC and substance use prevention isn't going anywhere at this point in time. We'll see. I still have to do some more work with my advisory board in April to solidify things for sure. But I've had, I don't know, 9 or 10 focus groups throughout the community. And substance use and mental health have come across at the top no matter where I'm at. Whether that's with the recovery community, with our high school students, the senior population, school resource officers, our fire department, it's trending that way no matter who I talk to. So it's kind of encouraging to see that the results from the focus groups I've had seem to be aligning. So from here, I decide on the top priorities with my advisory board, and then we will work on finding priorities, and that will be the next 3 years. Will be implementing different interventions to address these issues. So that's as much as I'm going to say right now.
Thank you. And thank you for letting me put you on the spot. I have to take 30 seconds to toot Molly's horn real quick, because I just really appreciate her willingness to meet and go in some places that maybe other folks haven't explored in the past, doing focus groups with populations that haven't really had a voice. So thank you for that, Molly. And I just think it's important for all of us to know that about the work that you're doing on our behalf. So thanks. All right. Updated flyers and cards. So as you know, we are trying to help pass along good, accurate information as much as we can. And so we have these available. If you, your agency, someone you know needs these, we have these on business size cards and also 5x7 cards. So please feel free to reach out and request those. I can drop them off, put them in the mail, however is the easiest to get them to you. But as you know, the more that we can get these things out, the more folks are able to utilize them. So let us know. Our other resources we have, harm reduction resources. We have places where we, have our harm reduction vending machine and our family custom cleaners here on Woodlawn and Lincoln, and also the health department has that available, as well as the Sharps drop off. And I think I have that an update coming up, so I'll wait on that. But there's other things that are being offered there, but we want to make sure you are aware. Also, not just Logan County, right? The first time we were talking about our harm reduction resources, it was Logan County. We are happy to say Mason County now has some options. And another option, so we have the Havana Library that's available, and also the health department now has those items available. So the contact information is there. So we're happy to share these things. So as I was not just creating these slides, you guys have seen, or has joined us before, have seen we talk about this, or maybe other folks have seen the news when there is a new access to harm reduction resources. Some of us are, we celebrate quickly, right? Which brings us into our conversation. And I have decided to call this Recovery Talk, with the subject being harm reduction, because I see us using Recovery Talk and what that means and some terminologies that we hear all the time. Sometimes I find that we can take for granted where other people are. Maybe I don't know what that is. Maybe I've come on this council and I hear some terms, but I don't exactly understand what that is. Or maybe I don't really agree with some of those things. I wanted to make room to begin to have some of that conversation with our council, because we are, right, this council and your circles of influence are how we are creating this change that we're talking about making in our communities. And so I thought it was a great idea to pause and have this discussion. Are y'all with me? Yeah. All right. So per the CDC, just so we're all on one accord as far as a definition, harm reduction is a public health approach that focuses on mitigating the harmful consequences of drug use, including transmission of infectious disease and prevention of overdose through provision of care that is intended to be free of stigma and centered on the needs of people who use drugs. Right? There it is. How many of us know just the words harm reduction can be a very controversial topic? Anyone? Yeah. Thank you. That's how many of us, even within our own recovery communities, this can be a weighty discussion. Yes? Right. Okay. I'm not alone. Good deal. And because of that, and because this came to my mind as I was being a fly on the wall in someone else's ROSC meeting, just kind of watching. It's amazing what can happen when you're an observer and you kind of step back from your role. And what I realized is that we don't all have the language, and sometimes we don't have the buy-in or even the understanding or maybe even the safe place to say, I don't really know what that means. I thought it important that we pause and create that safe space here within our council so that we can begin to have some of these conversations. This time, and this is a discussion, right? I don't intend that when we leave this space that we will have all the answers and everyone will be on one accord. What I want to do is create a safe space to be able to have the questions and begin to share what some of us, we hear statements that we may not even have a response for, right? And I have a couple of those examples here coming up, and maybe we can go ahead and pull them up so they can help me with kind of painting out this picture that I want us to consider. Have you ever heard this said about harm reduction vending machines? When are you going to install the free chemo stations for cancer patients? Or maybe about the syringe access resources. Let's feed into the problem instead of solving the problem. Or even recovery supports as a whole. Just let them die. Have any heard, comments like this or any of the alike? Yes? What do we say? What do we say when our neighbor says this? What do we say when the person sitting in the council okay, let me say it this way. What do we say when we're having a conversation with a first responder and their response is just let them die? Or when they see Narcan and we're not enabling them? What do we say? What do we say when we're part of a group like this and we don't fully understand? I may have an understanding or even acceptance of naloxone, harm reduction vending machine, but this needle exchanging business, I don't know, right? Because there's many layers to this thing. If you can take those down so I could see everybody again, thanks. These are tough things, yes? And I just thought it important that we take a moment to begin again. And some of us may feel that way. And if you do, if harm reduction doesn't sound like a thing that you're interested in or you don't get it, why are we supplying these things for these folks and not doing this for? I want to create that safe space to have that talk. This is not to convince you why harm reduction is a good thing. This is not to convince you why you ought to think the way I think or put words in your mouth. What we are hoping to do is create a safe space for honest dialogue, and that we can really hash some of these things out. And some of that is hopefully to share some of the responses that others have had, right? When we hear comments like this. And how do we, are there ways that we can equip ourselves to be better prepared as we continue in this work? As we continue to talk with our neighbors and our coworkers and our family members, right, who may say some of these things. So does that make sense? You want to take this ride with me? Are we going to do this? Okay. So the way that we were planning to do this is to do a couple breakout groups. Just sometimes we do feel like, you know, when we're broke out, we have a bit more of a kind of an intimate conversation, and we're able to communicate a bit better. I am happy to say that there are more people on the call than we had anticipated, which is really a great problem to have. But Grace, are we able to do the breakout? Are we going to do two? Two. Very good. So just to bring it to, so we're going to go to 2 breakout groups. Grace is going to help facilitate that. You'll get a little message and you'll break out in a moment. Now, I want this to be very clear. During our breakout sessions, those will not be recorded. I want you all to feel safe to have a genuine, honest conversation. And so I just want to reiterate that space will be not recorded. I asked that both groups, if you guys, other than me and Grace, someone could volunteer to do a report back to the other group. I would appreciate that and be thinking on who could do that for your group. And I'd just like you to use those quotes. Like I said, if that's something you heard, how did that make you feel? Have you experienced that yourself? What are some of the responses you may give or share or speak when you hear comments like that? And allow that conversation to take place. And then we'll report back. Make sense? Yes. Okay. All right, Grace, if you can help kick that off. And I think it was Jeff. Mentioned something about, you know, you brushed your teeth today, right? So that's part of harm reduction, right? And breaking it down to bring it to someone else's understanding, to also bring in the humanity to the topic of, you know, imagine if it was your loved one. There was a phrase, trying to share compassionate curiosity. How do we begin to have conversations with compassionate curiosity? Instead of course, we want to jump into an offense of when someone says, oh, let them die. Right? It's hard not to jump into that space of rebuttaling that aggressively, even for me. But how do I learn to say, wow, that's a really strong opinion. What brought you to that? Right? Again, you know, I think I mentioned something about trauma-informed care instead of what's wrong with you, what happened to you. You know, if someone has a strong opinion about addicts or using or something has happened in their life, their journey, their experience has formulated some opinion, how do we then make the decision to ask what happened there, right? How do we come to that conclusion and make a safe space? And so we were talking about how are we ever going to continue to bring people along or even keep the conversation going if when we get offended or there are ugly comments that we cut people off or we stop the conversation, right? We'll never be able to move forward. And we also spoke a little bit about when is it? When do we defend it, right? Do we spend our days behind Facebook and hit every comment, you know, until I would have no more hair in my head because, you know what I mean? Is that where we fight? Or but thinking about that, when is it appropriate to engage in those conversations and kind of thing? And so I do want to leave it for my group. Is there anything just burning that I missed that we want to shout out and share with the other group? I think the only last thing I can think of is to the comment of the question or the quote that we took about the when are we about the cancer chemo stations, right? Kind of the response to the, why are you doing it for this and not for these folks? And it was Sue Tisdale whose response I thought was just A1. And she says, when you lobby with leaders and bring the evidence to support it. And I loved that. That is the solution, right? Folks got together, lobbied, brought the evidence, and made things happen. We can't be mad at that. All we can do is encourage others. And I just wanted to put that in your pocket because that's something I definitely took away and thought that's a great, great reply. So that's a little bit about our group. They were fantastic. Thank you for all the engagement. What about your group, Grace?
Well, we killed it too. We were amazing. No, there was really, really good discussion between all three of the quotes. I think that some people, everyone shared, like either if they had like a personal experience with it or really just like how they would navigate the situation, which really helped. But because of time, that's all I got. Unless anyone from our group would like to share anything, go for it. No, that's okay.
No, I could have just, I just want to say that I appreciate like the conversation. I think it's like great conversation to have. I almost want this at our statewide ROS Leadership Center for all of the ROS. I think it's a super important conversation to have. And I agree with Grace. I think we had like a really nice chat with everyone and got just like some really cool insight on how some would address it. And yeah, so thank you for allowing us to have this platform, to have this discussion. I think it's super important.
Awesome. Awesome. And that was going to be my question to the group, just with nods or thumbs up or whatever. Was this helpful? Did this feel like, yes. Okay. And our hope is to continue to pull in other topics like medical assisted recovery, right? Like person first language, right? Like, so that's going to be our recovery talk, and then getting into some of these concepts and ideas, these principles, and really kind of breaking them down a bit more. So thank you so much for everyone's participation. I got a lot out of it myself. I want to say that. As I promised you, no worries if you missed Saturday, because we're doing it again this Saturday, Mason City at the Arley Theater. It is a really cool, neat theater. Small town stuff. We'd love to have you out. If you are an agency that hasn't signed up yet and you want to join us with your resources, because we'd love to have you, do not hesitate. It's not too late. If you can't make it though, and you have resources you'd like for us to share on your behalf, please feel free to let me know that. I can come pick them up. We can figure a way, but I would love to do that on your behalf. Well, before that, I want to make room real quick because it's upcoming events. Silas, I did want to give a couple seconds. I know your fundraiser is, the clock is ticking, but I wanted to give you an opportunity to shout out what Community Action's doing.
Oh, thanks. We are doing our biggest fundraiser of the year, which is Cheeseburger in Paradise, and it's got a bunch of fun stuff to do. It's April 27th from 6 to 10. I'm going to put Brianne's email in the chat box if you're interested in going to that. It's great for your team or your family or your friends. So just give her an email if you're interested in that. Thanks.
Awesome, Silas. Thank you. All right. Recovery in Action Subcommittee. We meet every second Tuesday of the month at the beautiful Hope on 5th building in Lincoln. Our next meeting is April 9th at 4:30. This is for anyone who is interested in getting involved. People with lived experience, allies, whomever. You have nothing to do and you want to help make a difference. Come join us. You are welcome here. Our next ROSC meeting is Thursday, April 18th at 2 p.m. Please help spread the word by sharing our social media outlets, liking, joining us. Like I said, these calls are posted on our YouTube video or YouTube channel for you to be able to access. And I know we only have a few more minutes, but I definitely, well, let me make sure our contact information is available to you all too here. But with the last remaining minutes, I want to make room for anyone who may have an event or some update that they would like to share with the group. I understand as those need to move on, please feel free to do so, but I want to give space for any updates and any updates that you would like for us to share out with our minutes. We'd be happy to do that on your behalf as well. So any updates, events, or things that someone else would like to share? Rachel.
Real quick, this tonight. This is not necessarily ROSC related, but we are having a Culver's event tonight. So if anyone wants to have Culver's for dinner tonight, 5 to 8, part of the proceeds go back to the Salvation Army.
That's awesome. Absolutely. Anyone want to support Salvation Army? Go grab some Culver's. Anyone else? Any updates, events coming up, things you'd like to share?
I have one, but it's not for a while, but I know summer books up quickly, so I wanted to go ahead and let people know now. We're gonna have trauma-informed care training here at the hospital from 4 to 6 p.m. on June 20th. So there are 2 CEs that you get if you stay for the whole event too. So that's always a good selling point.
Love that.
Let me know if you have any questions.
If you have a flyer or anything like that, we'd love to pass that along as trauma-informed care. If you don't know what it is, let's fix that. If you have staff that don't know what it is, let's fix that. If you have community members that want to learn what it is, let's help make that happen.
I have something in Ford County.
Yes, yes.
Our second annual All Awareness Day is scheduled for May 11th. From 11 to 2. It's just a powder paint run, food trucks, all that good stuff. And then lots of booths to bring awareness for the many, many different causes out there and resources and all of that stuff.
Awesome, awesome. And I think Molly put her email address. Anybody have information or have questions about the trauma-informed care training? She put that in there and that's your go-to for that. Thank you. All right. Well, it is 2:59 and oh, yes.
I do have a couple of things
Yes.
to add, if that's okay. They're really quick.
Yes.
Fulton Mason Crisis Service, we've added 2 more staff members, so we are able to staff our Mason County office a lot more, and we're more available during the week. And then also, we have hats off to Hope and Healing. It's our annual Fulton Mason Crisis Dinner and Auction fundraiser, and that's going to be Friday, April 26th from 5 to 9 at the Spoon River College multipurpose building. I am kind of taking over the Mason County stuff for Julie. You might have seen at previous meetings. So I will also put my email in the chat so you can add me to the list. And she forwarded me the information for today, but I would love to join for future meetings and stuff. So it was nice meeting you all.
I love it. Thank you. And Mason County folks, we want you here, right? We're so glad to have you and we look forward to building more with you, Caitlin. Thank you. I appreciate each of you. I'm going to hang back for a couple seconds if anyone has any questions or thoughts. Otherwise, I hope you have a beautiful rest of your day. And remember, what you do and what you're a part of matters. So thank you. We appreciate you. Have a great afternoon.